Well, hello, Thrive Nation. I've got one of my health heroes. He's been a health mentor to me for many years. I first met him back in 2012, American president of the Ozone Association in America. He's the founder and inventor of Prolozone. He's just been someone who's been a pioneer in the field of ozone. He's a man who I respect because he's had so much courage. He's had a calling to speak the truth. When I think of this medical doctor who's been using ozone, I think in his practice for over 30 years, he's a man of truth. He's a man of integrity. He's a man of honesty. And I think his character speaks more to me than anything else because he has stood up for what is right, for what is effective, for what has been used for generations in the medical field, but has been ostracized in many sort of fields in Western medicine, and that's the therapy of ozone. He's written many books, many articles, and so I welcome with deep gratitude. I welcome with great respect. I think of this man every single day because I use his therapy at least 10 times a day. I think of my clinical practice today, at least 10 times in a day do I use ozone therapy. And so thousands of patients have been treated by myself, but through a man called Dr. Frank Shallenberger. And so welcome to the show, Dr. Frank.
Well, Steven, thank you for that beautiful introduction. I'm so glad that you're able to help your patients with this marvelous therapy. And I'm looking forward to the day when there'll be more doctors like you all over the world, especially down there in Africa.
Yeah, great. I just want a quick backstory, Dr. Frank, and I call you Dr. Frank out of respect because doctor,
sure.
my absolute community knows that the root of doctor comes from the Latin docere, which means teacher. And not have you only used ozone, not only have you invented many techniques that I use in the practice, but you have committed a calling to teach others, to teach physicians, to teach the public, to write books. You've gone above and beyond. So tell us a quick backstory on ozone, how you got involved, because I do want to try and take every single minute. I know we've got an hour of your time just to express how important this modality is to every single person, I believe, that's alive, and especially those in Africa, because ozone is in its infancy still here in Africa.
I think it's pretty interesting. Back in the 70s, I'd been practicing medicine for about 6-7 years. And the word on the block back then was that, it was oxidant stress that causes disease and aging. And that's why it kills people through oxidant stress and such. And about that time, somewhere, somehow, I had heard that the Germans were using a treatment involving ozone. Ozone is an oxidant stress molecule. So it didn't make sense to me. People are dying from oxidative stress, and then now the Germans are saying they're making people well with oxidative stress. So I was immediately intrigued by that. Something's wrong somewhere. So I went over to Germany, and I subsequently learned what Paracelsus taught us like about 500 years ago, was that the same molecule that causes one thing in a lower dose causes an entirely different thing. And Paracelsus was the first person to point out that it's the dose that determines the effect of a substance much more than the actual characteristics of the substance. And so in Germany, I learned that it's true. You can have a patient in oxidant stress and give them an oxidative molecule. As long as you get the dose right, you'll fix the oxidative stress. So it seems kind of counterintuitive, but that's what happens. And that's what intrigued me. That's why I got into it.
Now, your dad was a doctor, I remember, and I think he started the process in terms of just you thinking, out of the box. I think you were reading a lot of his old journals, if I recall, reading the books that you've written. But I think it's a very unique characteristic to ask those questions in terms of why was Frank Shallenberger intrigued? Was it his nature? Was it his nurture? Who asked Frank to ask those questions, which I think is important in today's times, because I think people are just following protocols and not sitting and thinking out of the box to say, let me take a stratosphere view of medicine, of this oxidative, process that's happening in the body, and how can I use different modalities?
Yes, that's a really good point. One of my mottos has always been that you never learn anything from somebody who agrees with you.
Yeah,
You
true.
can't. They already agree with you. So either you're both wrong or you're both right, but you can't learn anything in either one of those situations. The only way you can learn something is when somebody tells you something that contradicts what you think to be true. There's an opportunity there to learn something. And instead of immediately throwing away any information that you hear that contradicts what you believe to be true, you should investigate that and look into that a little bit. And that's been my career. I've found a whole bunch of interesting things just with that particular kind of philosophy.
Brilliant. Well, let's go into ozone, what it is.
Okay.
I mean, most people who think of ozone think of the ozone layer and sort of the holes in the ozone. And just explain to the audience out there what ozone is.
So basically, ozone is oxygen. Oxygen is a molecule that doesn't have enough electrons. Because it doesn't have enough electrons, it can't exist in nature. It's not evenly balanced. So what it does is one oxygen atom comes up to another oxygen atom. The two get together and they share electrons. This is called O2. This is the oxygen as it exists in the atmosphere, because that's a relatively stable molecule. Where they're sharing the electrons, it's relatively balanced. If you were to split that molecule apart into O1, it can't last. It doesn't have enough electrons, so it'll immediately combine back into O2. But if you take O2, which is basically the oxygen that patients get in the hospitals, the oxygen in the tanks, the one we're all used to, you take that and run it through a box that shoots a charge into that box. What's going to happen is the charge is going to break the O2 molecules up into O1s. But I just told you that the O1s can't exist, so they're immediately going to go back to O2. But here's the interesting thing. About 2 to 3% of those O1s will go back into O3. That will be where you have 3 oxygen atoms sharing the amount of electrons that make 2 oxygen atoms stable. So it's not a stable molecule. And that's ozone. Ozone is basically 3 oxygen atoms instead of 2. It's an unstable molecule. It doesn't have enough electrons. As soon as you introduce it into any biological specimen, and by the way, that's one of the more beautiful things about ozone, is the applicability of it is just astounding. Any place you put it, whether you put it into an ear, you put it into an intestine, you put it into a joint, whatever, it doesn't matter. It's going to immediately go into that area, and it needs an electron. It's going to grab an electron and start the movement of electrons. It's the movement of electrons in the human body that heals the human body. It's how God designed our bodies so that this movement of electrons is what creates the healing, and in essence, actually what creates health. To a certain degree, we get that from O2. O2 is just enough to move those electrons. All that oxygen we breathe in is going to move electrons. But ozone is sort of like oxygen on steroids. It's going to move the electrons much faster, much more immediately, and you're going to get much more immediate results than you'd ever get with just oxygen by itself. So it's pure oxygen. It's not pollution. It's not contaminant. It's absolutely a pure source of oxygen.
So when that O3 comes, you're talking about the electron transport chain. It improves the movement of electrons, and improves that type of tunneling or electron tunneling. It improves the hydrogen back into the cell and produces more ATP. Is that what you're saying? Is that what it does?
Absolutely. In one way or another, it's going to cause those electrons to move around, and it's the movement of electrons that keeps us alive. As soon as my body stops moving electrons, I'm moving on. There's nothing here for me. It's the movement of electrons, and ozone, more than any other molecule, stimulates that. And by the way, listeners need to understand that the reason we get sick as we get older instead of as we're young, now I know there's unusual circumstances where people have genetic issues and such, but normally you don't get sick till you get older. The reason is because as we get older, the movement of electrons slows down. And ultimately, it gets so slow that basically you die. So we want to, keep those electrons moving in a very youthful way. And ozone is instrumental at that.
You're talking about early onset mitochondrial decay or disease
Absolutely.
or dysfunction. And that happens as we get older, or that happens when we develop some type of sickness, maybe due to epigenetic factors. And even talking about viruses and talking about what's happening in the recent sort of 18 to 20 months. How has ozone been so effective for your immune system from an immunomodulation point of view? I've never used ozone so much in the last 18 months, had such great results, all different ages, but how is it such a powerful immunomodulator?
Well, it's a good point that you bring up. So one of the things that ozone does is it stimulates the white cells to work in a better fashion. And now ozone does a lot of other things too. So that's just, if you were going to write a book about all the things that ozone does, one of the chapters would be on the immune stimulation, but there's all kinds of other things it does too. But what we do is when we introduce ozone into the human body, in that area where we are introducing it, now typically for the immune system, we're talking about introducing it into the bloodstream, which is where most of the immune cells are going to get in touch with this ozone. It's going to start electron movement in those white cells. That electron movement is going to start them to crank out the materials that they need to defend us from viruses and bacteria much more effectively than they would have if they weren't stimulated. In a sense, it's a stimulating procedure. So I get exposed to a virus, I've got an immune system response to that virus. If I take ozone, my immune system response for that virus is amplified by a factor of 3 or 4.
Sure, powerful. Tell us a little bit about the story of what happened in Sierra Leone in terms of treating Ebola, how effective ozone was, because I think people don't really understand the effectiveness of it and how it treated Ebola. People think, it's just like really a weak type of treatment, but I've never seen something so powerful and strong in terms of treating viruses, bacteria, infections, whether it's in the mouth, where it's wherever it is, it's just so powerful. How is it that this type of modality is not more well known or used or accepted by Western medical science? Although there are thousands and thousands of research papers, it just seems so complementary. It's seen in a world of alternative medicine and hasn't been accepted by the traditional Western fraternity.
Yeah, boy, now that's a question that doesn't have anything to do with science or medicine. So we could just say that. This is a question that has to do with money and politics. If our medical systems, and I don't mean just in the US, but probably around the whole world to some degree, if our medical systems were just concentrated on helping people, let's say that's all they cared about, just helping people, ozone be all over the place because it's such a huge help. But that's not what our system is about. Our system, bottom line, is money. Another thing is power. And so these are the politics of medicine that I don't know that people really understand, that just like with a lot of things in the world, there's politics in medicine. There's people telling us to do things or not to do things simply based on whether those things, influence the bottom line for some corporation. So we need to understand that, but it's true. If just helping patients were all the medical industry is about, ozone be all over the place, be used constantly, just like you are doing.
Great. Let's talk about sort of the applications of ozone, and let's start with my favorite, which is Prolozone, and how effective it is into joints. You invented this type of treatment, and I think it's really powerful. It's almost, sometimes I look back and it's too good to be true. Someone who's had 10 years of chronic pain has one Prolozone session and all of a sudden kickstarts a process that is incredible. Just give us the ins and outs of Prolozone and why it's so important.
It's great, Stephen. You've been doing this for a while and you're still surprised at how well it works. I've been doing it for decades and I'm still surprised. I can't hardly believe it works this well. And I've been doing it for over 30 years. So it's that amazing therapy. In essence, what happens is that ozone is basically going to do two things. First thing is it takes away pain. Now, how it takes away pain is because of what causes pain. What causes pain is a lack of electron movement. Now, it's really interesting, but when I first learned this, I started calling up pain specialists, and I was telling them, listen, I'm injecting ozone gas into areas that hurt and the pain goes away. Tell me why. You're the pain expert. You should know what the heck's going on. Tell me why. And pretty much, this was like 10 years ago, but pretty much every one of them I talked to said, look, man, we don't know what causes pain. And I said, you're a pain expert, but you don't know what causes pain. Yeah, well, I can tell you what fixes pain is by moving electrons. So it seems to me that what's causing pain is a lack of movement of electrons. And in a way that makes sense, because who tends to have chronic pain? Is it younger people with good electron movement, or is it the older group? As we get older, don't we start to have more and more pain? And the pain doesn't seem to go away a lot of the time. And that's because there's a lack of electron movement. And that lack of electron movement can be throughout the whole body, or it can be in just one area. So I go and I damage my knee, and because I have a lack of electron movement from the trauma and in my general body, because I'm older, the knee won't get better. So then I take some ozone gas, and it hurts. So I take some, because when you don't have movement of electron, you accumulate acid in the tissue. So it hurts. That's what I think is causing chronic pain, is lack of electron movement. It's the only thing that explains this, because if I take a syringe of ozone and shoot it into that area, the pain goes away. It's like, how did that happen? So it's repairing the actual thing that's causing the pain, which is a decrease in electron movement. The other thing that ozone does, besides taking away pain, is it can actually regenerate and heal damaged tissue. So if the tissue isn't damaged so much that it's literally beyond repair, at least it can take away the pain. But if the tissue is not so damaged, it can literally regenerate the tissue and cause a permanent healing.
Sure. Fantastic. All right, so that's Prolozone, injecting gas into different areas, different joints. Tell us a little bit about the research, or just maybe a personal, I've been using 20 gamma in joints. If you're using sort of trigger points, or you're keeping at 20 gamma, you've got years and years of experience. I know the Russians have been doing ozone for many, many years, from the Germans, obviously, you heading up the American Association of Ozone Therapy. But tell us a little about sort of volume and gamma concentration. Have things changed, or what have you found in your personal capacity?
So I think we need to understand that depending on the situation, you're going to use it differently. So, for example, when we're talking Prolozone, this concept of injecting ozone to treat pain, we can inject that in joints, we can inject it into backs, we can inject it into necks, we can inject it into fingers, we can inject it into sinuses. Literally, if it hurts, we can inject ozone into it, wherever that pain may be. So that's one treatment for ozone. I think most everybody, almost all the doctors, including me, have sort of just arrived at, by empirical evidence, a 20 gamma concentration. That's probably what you use. Yeah. But I've been using that for maybe 20 years. I've tried 30s, I've tried 10s. A lot of my other colleagues around the world have experimented with them, but it seems like we're all coming around to like settling in and around 20. Okay. So that's how we get that. But when you're using ozone in other applications, say you're using it in an intestinal application, because it's absolutely astounding for colitis, for Crohn's disease, ulcerative colitis, mucositis colitis, any of those kinds of problems, you put ozone into the intestines, it'll take care of that. You could put it inside bladders, take care of bladder cancer. I mean, you can do all kinds of stuff. But in those various other situations, we're going to use different concentrations. For me, if I'm treating blood, I'm going to typically use about a 78 gamma. Now, somebody else may use a different one, but I think the 78 is the best.
Okay. Well, let's go to rectal insufflation, because that's a very common sort of modality we use. I do it twice a week at least. I've seen biohackers like Ben Greenfield, and they've got their own ozone generators at home. They're doing their own rectal insufflation. I know you've written a recent book for the public in terms of how to use ozone. Can someone get an ozone generator? They've got ulcerative colitis, maybe they've got IBD, they're really struggling with irritable bowel disease or irritable bowel syndrome. What are the gammas, and where can they find information? Can they download your book? Can they do it themselves? Do they have to go to an ozone practitioner? Because I believe that this rectal insufflation is probably, from a lymphatic point of view, extremely, extremely important.
Yes, and I agree with you totally. So the name of the book that I wrote is called The Ozone Miracle, and it's specifically written for lay people, because I believe in a perfect world, every family would have an ozone generator. It's like very handy for almost anything that comes on. It's like you get a cold or a flu or a virus, for example. Everybody has to deal with that in some way, shape, or form. Ozone is something you should have at home. It'll knock it out. Say you get an injury of some kind, it can fix that. Say you get sinusitis, it can fix that. You mentioned all the intestinal sorts of problems. It'll fix a lot of that. So there's a whole lot of things that people can treat themselves at home. They don't necessarily need doctors for this. And so I explain that in the book, and I tell people sort of how it works. I explain this electron movement thing, talk about the various situations, and it's basically a paint by numbers type deal. So if you have such and such a symptom, you could look that up in the book, and it would tell you how to use your ozone equipment to fix that particular system. And it's true, like some people with more serious problems are going to need a doctor like you to help guide them through that. But this is real. For example, with the ulcerative colitis and the Crohn's patients and the inflammatory bowel disease patients, when I'm treating them, I sort of make them go out and get their own ozone generator, because otherwise they got to keep coming to my clinic day in, day out, and that's going to be an expense to them and just a big old hassle when they can do it all themselves at home. But I will guide them through it. I'll tell them how to do it and give them encouragement and all that kind of thing.
Great. So it's not only for physicians, it's for the public, and we'll put reference to that book, which I think is very, very important. Biohackers, whether it's Dave Asprey, or I know you've been on Bulletproof Radio with Dave, and incredible sort of amount of downloads that Dave's getting. So I think it's for the public, and I think anyone listening out there, this is not only for sick people. This is to prevent a significant amount of disease. And I think if we talk about ozone, how important it's been to prevent chronic disease like early onset mitochondrial decay, which is involved in every single disease from what I know, I think it's crucially important that people tap into this and try and only use Western medicine in emergency medicine. I think we've also got to understand it's not non-use of Western medicine, it's correct use. I think you have a car accident, you need surgery, don't come to me. Make sure you go to the surgeon and do the correct type of treatment.
Yeah, that's a really good point. And I'll tell you that for myself, I give myself an ozone treatment in the blood at least once a week.
Okay.
And I'll do the rectal treatments as well, keep the microbiome and everything they're going as well. We also have an ozone sauna at home. So I'm a big believer in being proactive and doing this proactively, because you never know. I mean, anybody could get on an airplane and be sitting next to somebody with Ebola or God knows what. Or you could walk out the door and trip and break your ankle and need surgery. I mean, you just don't know what's going to happen to you. It makes totally good sense to make your body be ready for whatever's going to happen, so it responds in the most positive and beneficial way.
Yeah. Let's talk about the microbiome. There's so much research. We've had a lot of doctors talking about how important the overall microbiota is, whether it's an oral microbiome, your nasal microbiome, whether it's your gut microbiome. Now we're using rectal insufflation, and what does it do to the microbiome? Because ozone is so good at dealing with, or I don't like to use the word killing, but dealing with bacteria and fungi and parasites and all these parts of the body that sometimes are unhelpful. Obviously, we need the correct balance, and we need the microbial diversity that's important, Dr. Frank. But tell us, what does it do to the microbiome?
I have to say, first of all, I'm not a big expert on the microbiome. I know about it in general sorts of terms, but I guess for the listeners, they want to know that not all bacteria are bad. And so we have a lot of bacteria in our body, and you just pointed out where, mostly in the respiratory tract and in the mouth and in the whole GI tract, in the vagina, and interestingly enough, in other places too that they don't tell you about. But anyway, we all know about these bacteria, and they're not bad. In fact, many of those bacteria serve very purposeful things. They make molecules. Some of them are vitamins, but they make other molecules that are very stimulating to the body. They make a hydrogen gas, for example, that is incredibly important for the body. Our bodies can't make hydrogen gas, but the bacteria in our bodies can, and that hydrogen gas is great. So normally you kind of think of good bacteria and bad bacteria. So the good bacteria that do wonderful things for us. The bad bacteria are bacteria that don't do wonderful things for it and may in fact be harmful and upset the good bacteria. So there's this balance, and we call this collection of bacteria. And there's thousands and thousands of them. I know that much. And so we call this balance. We call that a microbiome. But you want to have the balance. So you have like relatively few of the bad bacteria and of the right balance of the good bacteria, and you get all the benefit out of it. The problem is what happens is mostly due to antibiotics, but also due to just bad living and incidentally stress. There's some I don't know if you've seen this, but there's some really interesting articles about how stress affects the microbiome and creates all kinds of inflammatory conditions, just stress. It's really astounding. And so there's lots of reasons for that microbiome to get out of balance. I believe ozone, along with other good habits, like, for example, dealing with the stress or dealing with bad eating habits or whatever, can help to bring about a better balance in that microbiome, no matter where you put it. Because you can put ozone up the nose, for example. You can put it in your mouth. You can put it in your ear. You can put it all kinds of places where there's a microbiome.
So it's not destroying all the good bacteria. I had Dr. Thomas Levy on the show talking about, and I want to go into hydrogen peroxide nebulization because that's something that I found out from you quite a while back, and it's been just an absolute game changer for my sinus patients, my respiratory patients. But what does ozone do to the microbiome? Is it killing the good bacteria, or how does it balance it out? It seems to, because like if you got this bad infection, you got this, say you've even got you've got a colitis, and you've got really a lot of pain, and then you use this insufflation, this rectal insufflation, and all of a sudden you're feeling so much better. It's obviously killing or destroying the bad bacteria that are causing the infection, but how is it not killing all the good bacteria and just decimating your microbiome? Even ozone water has been used for so long by a lot of practitioners, but you put it into the gut, does it not kill all the good bacteria, Dr. Frank?
It's a great question, and the answer is no, it doesn't, because that's almost the definition, a part of the definition of good bacteria is that they can use oxygen. They can metabolize oxygen. They like electron movement. The bad bacteria don't like electron movement. They do better when there's very little oxygen around. They just, for some reason, they don't. We were designed to be people that lived in a high oxygen world. And so that it makes just total sense to understand that if we're designed to live in a high oxygen world, the bacteria in our bodies must be pretty much similar. So bad bacteria are bad bacteria by definition because they cannot easily tolerate oxygen and the electron movement that oxygen stimulates. So when I put ozone into an area, it might knock off some of the healthy bacteria, but it's going to knock out way more of the unhealthy or unfriendly bacteria and create a better balance overall.
Fantastic. What a good summary there. And I think that's really, really important for people to understand. Let's move on to hydrogen peroxide. I had Dr. Levy, who speaks highly of you. What an incredible
He's a good man.
Yeah, he's a great
fantastic
doctor.
Guy.
A lot of time for him. And then I'm having Dr. David Brownstein on as well. He's going to be on the show. I'm a real believer in hydrogen peroxide. I've probably dispensed, I don't know, hundreds of bags in the last 18 months. So
Yeah.
powerful. And listening to Dr. Joseph McCullough about his concentration, trying to get the concentration. I don't want to get into the weeds on hydrogen peroxide, but how is it so effective that you can nebulize hydrogen peroxide and it can have such an absolute, incredible, almost supernatural effect on both the sinuses, the throat, the gut function? What is happening with hydrogen peroxide?
Well, hydrogen peroxide is a similar molecule to ozone. It's not as strong, but it's similar in the sense that it also wants an electron. It also is going to create electron movement. But ozone is too strong. You can't inhale ozone because it'll eat up your lungs. It's way too strong. It's going to move the electrons, and the lung tissue can't tolerate that so much. But hydrogen peroxide in a weak enough solution, you can inhale that very safely, and it's going to cause electron movement. And of course, we put a mask on, and then you inhale it through the mask. So it's going up through your nose, into the back of your pharynx. Well, where the heck are viruses anyway? They're in your nose and in your pharynx. That's where they are. So it's immediately going to kill these microbes on contact. And the other thing that it does is, as you inhale anything into your lungs, everybody knows this, whether it's a cigarette or a medication or hydrogen peroxide, doesn't matter. Whatever you inhale into your lungs ultimately gets into your bloodstream. So now it becomes a systemic treatment. So it's the beauty of it is, number one, we're directly killing the microbes that happen to be in the path of this hydrogen peroxide as it's going down into the lungs and killing all the microbes down there. And secondly, it's now getting into your bloodstream and going wherever it needs to go to stimulate electron movement in any other part of your body where there's inflammation. And it's just an absolutely a marvelous treatment, 100% safe. You can't go wrong with it. Nobody ever has a side effect. And I like any of my colleagues to tell me where there's something as powerful as this with zero side effects.
Yeah.
That's not going to happen. Yeah.
No. Through the pandemic, I had family, friends, patients have a preventative protocol on C19, and in no way is this all medical advice, but you know, when we dispense out this hydrogen peroxide, if they would use it up to 6-7 times a day with incredible results, and haven't had a patient in the clinic hospitalized or lost to C19, which has been, you know, testament to, I think, a lot of these type of therapies that are so powerful for the immune system. Even patients with autoimmunes, rheumatoid arthritis, any of these have done exceptionally well by using, you know, hydrogen peroxide and ozone therapy. So give us your view. Dr. Levy talks about injecting the tonsils in his book, Rapid Virus Recovery. I didn't, when I studied many years ago with you, and obviously did the course again in 2015, but how does that work, that one could inject the tonsils where there's infection?
Yeah, so the tonsils, for the listeners, the tonsils are little areas in the back of your pharynx in here. So when you breathe in air through your nose, now the air looks like there's nothing in it, but as everybody knows, there's a lot of stuff in there. There's dust in there, there's bacteria, there's mold, there's bugs, there's all kinds of interesting stuff in the air that we breathe in. So it's going to go in through our nose, and as it's going down into our lungs, it's going to pass by these tonsils. So this is an area where that's a very large amount of immune system cells. And what they're doing is they're sort of like gate checkers. They're checking everything that's coming in that air. And they're saying, hey, wait a second, you know, there's a bacteria there, or there's a pesticide molecule there, or there's something there, and we need to have an immune system reaction to that. We need to be ready for that. So in case that ever causes a problem, we can take care of that. So that's what the tonsils are charged with. The very first gatekeeper on everything that we breathe is those tonsils. And they're very handy. If they're removed, it's going to be a little bit more difficult for people to maintain healthy immune systems because they're that much involved. So what Tom is talking about is actually an old German technique, and I know this goes back to at least 1943.
Wow.
The Haneke brothers were, I think, one of the first people that brought this up. At that point, they were injecting something called procaine into the tonsils, and they'd look back in there and say, "Oh yeah, those tonsils, they're having a reaction. There's white spots on there. They're inflamed. They're swollen. Something got in through that air that's got them working, and that immune system's working overtime." What they've discovered was if you inject some procaine into the tonsils, it calms them down a little bit, so they don't create as much of a problem. So that's where all this came about. For myself, just so you know, Stephen, I'm not big on injecting tonsils anymore. I used to do it. I think we can do just as well these days by inhaling hydrogen peroxide.
Okay.
So I know a lot of doctors still do it, and I know it's effective. I think we could probably do just as well without having to resort to that. But it is an easy procedure to do. I don't know if you've done it or not, but it's pretty easy to do. Yeah.
No. Maybe I've got to come hopefully again and see my other mentor, Dr. Ross Hauser, and come spend some time with you and have a look at that procedure. But Dr. Lee also talks about using a water flosser and hydrogen peroxide. I don't know what your experience is. I've started using it and started recommending some of my patients that struggle with a lot of cavities or a lot of infections in their mouth or their sinuses. I don't know your experience with using a water flosser and hydrogen peroxide.
I haven't tried that. That makes all the sense in the world. What I do recommend my patients doing is get their toothbrush, stick it in some 3% hydrogen peroxide, we just buy at the drugstore, and then have a little bowl of baking soda, sodium bicarb, and dab that in there. So now you got a toothbrush with baking soda and hydrogen peroxide. Throw a drop or two of essential peppermint oil on top of that, and then brush their teeth with that.
Wow.
And that will cure darn near anything that's going on in the mouth.
Sounds good. And I think that's just so many years of empirical evidence and just using your experience over the years, what patients have taught you, what you've tried. And I think that's the beauty of it. It's affordable. It's available to everyone who's listening. Let's move on to another application, ear insufflation. How much do you use of that? Is that good for ear infections? Is that good for sinus infections?
Yes. This is an area that we're looking at a lot more, especially over the last 3 to 4 years. We've been looking a lot more at this. There's not a lot written up in the scientific literature. As you pointed out earlier on, there's thousands, literally, of scientific publications published in peer-reviewed journals from all over the world on the use of ozone therapy, but very few of them have anything to do with this particular technique, which is where you put ozone gas literally into the ear canal. What it's going to do is it's going to create electron movement in your ear canal, the tissues in your ear canal, and also in the tympanic membrane with the eardrum, so to speak. So that electron movement is going to create certain things. Behind the eardrum is a tube called the eustachian tube, which then goes down into the back of the throat. So this electron movement will then go through the eardrum and actually go into the middle ear and then down to the back of the throat. So, and then there's some lymphatic connections from the ear canal. So we have a good rationale as to why this works. But the reality is this. If you properly do it, and you got to know how you're doing it, because if you don't do it properly, there could be some issues. But in my book, for example, I go over this technique. But you properly introduce ozone gas into the ear canal, it can be helpful for herpes infections around the face. It can be helpful for ear infections. It can be helpful for colds, flus, sinus conditions, even headaches. Anything in this general head area, it could be helpful with. The only thing I've not found it been helpful with so far is tinnitus. The ringing in the ear thing. I've not really had much luck with that.
Tell us a little bit about your protocol. What gamma are you using for ear insufflation? How long are you? Because I think that's important. I've experimented over time. I'm sitting at like a 65 gamma for like 7 minutes, 8 minutes, making sure there's no ear pressure developing. What is your experience and what do you use?
You know, that's something that we need to learn more about, tell you the truth. And I said we're learning more about this over
Mm.
the last few years. One of the pioneers in this area, in fact, he may be the pioneer in the area, is a dentist by the name of Dr. Dennis Mihalka, and he's given us a number of lectures on some of the experiments that he has done with this. He's totally devoted himself to doing this
Wow.
properly. And he is now using concentrations upwards around 100.
Sure.
So very high concentrations. I'm, on the other hand, used to using relatively low concentrations, like 35, something in that zone. And maybe I'll do it 35 for 5 minutes twice a day.
Okay.
But Dennis has taken this another way, and he's probably onto something. I've heard some great clinical stories about some cases he's reversed that were pretty astounding to me by using very high doses, kind of similar almost to what you're doing. He's got people on there for 10, 15 minutes at extremely high concentrations.
Okay. Let's talk about the Rolls-Royce major autohemotherapy
Mm.
and how important it is and what conditions it treats. I think it's very, very important that there are different applications for ozone, where you inject it in for a tooth abscess or through the ears. That's the beauty of ozone, as you said, into muscles, into joints. Ozone olive oil for the skin, which I think is an absolute game changer for the teenagers in my practice. I've never seen something work so well using ozone olive oil and then using a probiotic cream in the day and then using the ozone at night. So there's just applications wherever you look, even putting ozone olive oil in the mouth on the gums when there's an infection or there's a
Yeah.
little nick. There's just so many uses. Tell us about major and even minor autohemotherapy, and then the latest sort of 10 past major autohemotherapy that people are doing.
All right, so let's start with what we call major autohemotherapy. This is, I think, as you pointed out, the sort of the classic. This goes way back to the early 60s when it was first developed in Germany, and we still use it today. Some of us make some variations on it, but pretty close. It's the way it was originally established in the 1960s. It's a very simple, safe, easy procedure. Basically, we put a needle into a vein in an arm, and then we let the blood drain out. We drain out anywhere from 100 milliliters to maybe 200 milliliters, something in that zone. And once the blood's drained out into either a bottle or a bag, we can then inject ozone, which is a gas, into that bottle or bag, kind of mix up the blood. And what's immediately going to happen to all that blood is every cell in that blood is now got electrons moving around like crazy. Including you've got immune system cells in there of all different kinds. And the immune system cells, as they move these electrons faster and faster, what's going to happen is they're going to become much more effective at what they do. We kind of alluded to this a little earlier. And then you got red blood cells in there. They're going to do all kinds of interesting things, all of which is described. I mean, we know this stuff. But there's going to be a lot of interesting effects to the red blood cells. And then you've got platelets in there. It's going to affect the platelets, and the platelets do a lot of very interesting things, especially around restorative things. And then we're creating a lot of peroxides in the blood itself. So that's what's going on now in that blood that's just been treated with the ozone. So then we take that blood, which is now almost like a medicine, hang it up on the thing and run it right back into the patient. And the whole thing takes maybe 45 minutes, half hour, something like that. But when that blood gets back into the patient, lots of things start happening. The peroxides in the blood start initiating electron movement all over the whole body, including the brain. The white cells in the blood home down into the spleen and the lymph nodes and the liver and the bone marrow. And these white cells go into these areas and induce electron movement in all the other white cells. So this is huge for infections, particularly the C19 that we're seeing, but it's just for any viral infections, it's about as close to a knockout punch as I've ever seen, because of the way these white cells get in there and immediately start turning on all the other white cells in the body.
Okay.
And the red blood cells are great for the circulation issues. And so what you can repeat this. So you could do it in the morning, you could do it again in the afternoon, you could do it 3 times a day. If you got somebody that's sick in a hospital, you could do it 5, 6 times a day. It's easy to do, incredibly cheap, and 0 side effects, 0 dangers of any kind. So that's your standard major autohemotherapy. The multipass that you're talking about is when you do that repetitively, one right after another.
Okay.
So I'll treat 200 cc's. When that's done, I'll treat another 200 cc's, another 200, another 200. I might do that until I get maybe 1,000 cc's treated, maybe 2,000 cc's treated. That's a very high dose method. That's the lower dose is much better for chronic conditions, things that have been going on for a long time. The higher dose is better for acute conditions and for autoimmune conditions that are in a flare, like a Lyme disease or a rheumatoid or something like that that's in a flare. We like the higher doses. The lower doses are good for somebody who's got rheumatoid but's not in a flare, for example.
Great, thank you. Let's now, I think we've covered, I mean, minor autohemotherapy would just to draw it up into a syringe, then re-ozonate and inject it in. So you're not taking out significant amount of blood, you're taking out a syringe, probably 10 cc's, maybe 20 cc's. Is that correct?
Yeah, so the minors is different, is exactly as you say, only instead of running the blood back into the patient's bloodstream, you take the blood, and it's actually a small amount, right? Like 5 cc's. It's a very small amount, but you take that and you inject it into the muscle. So when the blood goes into the muscle, it's a different effect than when it goes into the bloodstream. When something gets into the muscle, it immediately starts stimulating an immune reactivity. So what we know is in our blood is whatever's causing us a problem, whether it's an allergy or a microbe or whatever's causing us a problem, could be a pesticide for that matter, it's in our bloodstream. So when I take the blood in that syringe now, I have whatever's causing my problem. So I ozonate that. I apply electron movement to that. And what I do is I alter it in a way that it's not harmful to me now. If I inject that back into a muscle, I'm not going to get an infection. I'm not going to get anything bad happening because the ozone is taking care of that. But when I inject it back into a muscle, the stuff that's causing me the problem is going to be going into that muscle, and my immune system is immediately going to start reacting to that, and I can desensitize myself to that problem. So it's really good for patients who are sensitive to something, whether it's a petrochemical or it's a pollen or whatever the heck is. We use it a lot for allergies.
Oh, wow.
We also use it a lot for autoimmune disease, because a lot of autoimmune disease is sort of is kind of an allergy that's expressing itself in a different way than allergies normally do. So it can be really handy for that. I like to use it a lot for cancer, because what's in that bloodstream? It's the cancer cells. So we inactivate them with the ozone and then inject those cancer cells back into the buttock, stimulates the immune system, and the cancer patient's going to probably do a little bit better from that.
Fantastic. I don't know if there's any other comments on ozone before we talk about the future of ozone. Dr. Frank, where's it going? How's it growing in terms of the American Association of Ozone Therapy, the doctors that are being using it, state laws, or US laws or international laws? I know that you're well connected all over the world with regards to the Ozone Association. What is the future of ozone and where is it going?
Good question. I will say that we started the Academy, I think 11 years ago. At that point, there were 1,800 published papers that we had access to. There's now well over 3,000 published papers. So, and I have to say that the number of published papers is escalating. It's going up. It's accelerating. So we have more published papers in this year than we did the year before it, and so forth. So it is definitely taken off. It's in many ways a grassroots movement. Much of medicine is controlled by pharma, and pharma actually doesn't like this. And so pharma is trying to put it down. Pharma has a huge effect on the regulatory systems of the various governments, like in the US, the FDA and such. So the FDA wants to put it down, and all these associations want to put it down, and yet practitioners such as yourself and many other practitioners like you understand that it's so important, they're not going to put it down. They're going to continue to use it. And so the word is getting out, but it's a grassroots movement. You're not going to really hear this hardly at all. You might in some circles, but you're not going to hear this in conventional circles. And I don't know if you ever will. I don't know if that will ever change. But I think what is definitely changing here in the United States is 11 years ago, we had a relatively small amount of practitioners that were using ozone. That's probably multiplied by 10 to 100 times now. They're all over the place now. So while mainstream medicine is not accepting this, and in all likelihood never will, still in all, people have a choice. They can go out and they can find somebody such as yourself in the area that knows what they're doing, and they can get this this therapy for themselves.
Fantastic. And quickly, now that we've got a little bit of time, maybe just as we're closing the show, your C19 protocol, I've got it from Dr. Levy, I've got it from many different doctors on the show. I think it's important just being able to give people just an ear to listen to other options. How do you treat someone who's, you know, got the SARS-CoV-2 in the different stages? And what is Dr. Frank Shallenberger's protocol?
Okay, so basically, I try to get proactively tell my patients what to do. So I've emailed all my patients, and so that they know what they're supposed to do. We look at basically 3 tiers of treatment. The first tier is things that you do just all the time. You never stop this. You do this all the time to protect yourself from all kinds of viruses, including C19. And that is, you take some vitamin D. You take some vitamin C. You take melatonin, which is an important molecule for the immune system. You might take, I like my patients to take the herb astragalus. Astragalus is a very good immune system stimulant. And it stimulates what we call the innate immunity, which is key to preventing viral infections. And you do all the lifestyle stuff. You know, you don't stress out. You get plenty of sleep. You stay in good aerobic condition. You get sunlight. You keep well hydrated. All the stuff that everybody knows anyway. So you combine all that. You take a few extra vitamins and minerals and maybe some herbs to put you in a position where if you get exposed to a virus, we know, for example, that something in the order of 30% of people who get infected with C19 never have symptom 1. So what's that all about? What it's all about is their innate immunity is working so well that they don't even get any symptoms. They're immunized, they had the infection, but they never had a symptom. And because their innate immune system is working so well. So this helps keep that innate immune system working well. You could actually, if you have ozone at home, you could use ozone like I do once a week. I'm around patients with COVID all day long. So far, you know, I'm okay. I've not really had a problem. And probably that's one of the reasons. So that's the first tier. Just be ready, be proactive in case you get exposed to anything, whether it's C19 or something else. Second tier is in your medicine cabinet, have some hydrocortisone, which in most countries is going to be a prescription thing. So you have to call your doctor, say, give me a prescription for hydrocortisone, keep that in there. And have also a nebulizer and some hydrogen peroxide in the correct dilution. You can learn about this online, and you know, I tell my patients how to do this. And have some quercetin on board, have some aspirin on board. And let's see, some very high dose vitamin D, in this case, 50,000 unit vitamin D high dose. Just have that on board. So let's say you wake up one morning, you say, oh yeah, you know, I think I'm coming down with something. I feel a little scratchy in here. You know, I know I'm coming down with something. People want to get on this soon. Do not wait until you're sicker than heck and then decide to do something about it. You're digging out of a deep hole instead of digging out of a shallow hole. So then they go to the medicine cabinet, they haul this stuff out, they do the nebulizer. I tell them to do it every waking hour for 3 cc's of the hydrogen peroxide solution. every waking hour. They take quercetin. We typically give them like 400 milligrams 3 times a day. We give them vitamin D, 50,000 units a day. We give them vitamin A, 25,000 units a day. Something else. Oh, the hydrocortisone, we give them 20 milligrams of that. And aspirin, I give them a 81 milligram aspirin to prevent all the clotting that sometimes you'll see from the spike protein. And I typically give them some nattokinase too, 100 milligrams of that twice a day, just to deal with any clotting issues that could arise up. Most of the serious complications that happen from C19 are from clotting. So this will prevent that. And then you just do that. And I tell them, you know, you're probably not going to need the 3rd tier. But if you do, the 3rd tier is to find somebody like you where they live that knows how to give them ozone intravenously with the MAH technique. So you got that doc lined up. And so if you're doing the medicine cabinet routine for 2-3 days, and for some reason you think, you know what, I don't know that I'm really getting over this fast enough. Don't wait, go in to see the doc. The doc will go ahead and give you an MAH ozone, follow that up with 25 to 50 grams of vitamin C IV, and probably throw some ivermectin in there. I love ivermectin. It's worked great for me. So we'll put some ivermectin in there to the order of 1 to 2 milligrams per 10 pounds of body weight, whatever that translates out into kgs, with similar type deal. And it's a knockout punch. The only ones I ever have any difficulty with are the ones that waited 10 days to 14 days to get in, and now they're sicker than heck. 100% I fix them, but it's not quick. It could take 2 weeks to fix those guys.
Yeah, sure. Fantastic 3-tier program there by Dr. Frank Shallenberger. And the last question, Dr. Frank, is what else would you like to share about ozone, or what question have I not asked you that you'd like to just share with the audience? A lot of people listening now all over the US. We're growing there with a show, and internationally. What would you like them to know about ozone?
Well, geez, I think we've covered an awful lot here. What can I say? The message that immediately comes to me is, and it's sort of a general message about health in general: be proactive. You know, we're used to, and I think because the system operates that way, but I think so many people are used to, you know, I'm just going to live my life as it plays out, and if I get sick, I'm going to deal with it when I get sick. I don't think that's smart. I think what we want to do is say, I don't want to get sick. You know, one of my other mottos has always been, the best treatment for any disease is don't get it. Yeah. And so if we think proactively, and I know you do, and all our alternative colleagues do, but you know, live right, and you throw some ozone on top of that, that's just cherry on the top. It's all great, but it all starts with the foundational stuff that your grandmother told you about, in the sense of just hygiene, health, aerobic potentials, all the kinds of things that everybody knows. I will mention that I wrote a book called Bursting with Energy. In that book, I describe a great way to test yourself. Doctors, some of the doctors around the world have this capability. By the way, I'm going to also put a little plug in. If people go to YouTube and they just search Shallenberger disease is optional. Shallenberger disease is optional. I got a 5-part video series in there that explains how you get proactively to the point that no matter how old you are, you feel and function great, and you never get sick.
Sure. Wow. Well, we'll put that in the show notes, and hopefully maybe in the new year we can talk about, we didn't get into bioenergetic testing, aerobic capacity, which I think is important. You know, we've hopefully will one day be able to get that testing here in South Africa once we've got a sort of a bigger clinic with more patients that will do that testing and aerobic capacity testing, which I think is important. So, well, Dr. Frank Shallenberger, I salute you. I just declare blessing and favor over you, over your family, over your children, over your grandchildren, into the next generations. You're a man of you're a God-fearing man. You're a man who's really of much courage, as I've said. I want to deeply say thank you. I'm so grateful for your calling to hear about Prolozone and Ozone and how many patients that I've treated myself, my family, and all those people that have come to my clinic here in Johannesburg. So thank you so much. And I trust that you're going to be this beacon of light that carries on treating patients. I think of Dr. Ross House's mentor, Dr. Gustav Hemwell, who's still doing prolotherapy into his 90s. I can still see someone like yourself still treating patients well into your 90s, or maybe even extending your longevity even further. So thank you so much.
It's been an honor, Stephen. Thank you. Keep up the good work. You're doing a great job there. Appreciate it.
Thanks so much. All right, Dr. Frank, just one last thing for social media, if it's okay. If you can just repeat, we're going to put this on social media, if that's all right, on YouTube. If you can just say, this is Dr. Frank Shallenberger on the Made to Thrive show.
Hello, this is Dr. Frank Shallenberger on the Made to Thrive show.
Brilliant, Dr. Frank. Thank you so much. I hope you have an incredible day. Thank you for your time, and thank you for giving it up. And hopefully I'll be in the US. I know you're in Carson City. Do you still run? If people, I didn't ask this question, and that's maybe sort of just a miss of me. If practitioners want to do training, are you still offering training? Or if they want to be able to do major autohemotherapy, how do they learn now? Where do they go? What do they do?
Yeah, so they can go to ShallenbergerOzoneCourse.com.
Okay.
And I'm doing 3 trainings a year. People that have already been to those trainings, or like yourself, for example, are welcome to come in and just hang out at the clinic.
Okay.
A little bit, and go into the infusion room, or go into the colonic room, or whatever, and just kind of hang out for a few days, see what we do, and all that kind of stuff, to get some little extra sort of training or expertise.
If someone got no training, then they do the course. They do the full course, and is that at your clinic?
Yeah. So the full course is at a hotel around. It's not at my clinic.
Okay. All
right.
right.
We got way too many people. We got like 100 people there.
Okay. So it's in Carson City, though.
So my clinic's in Carson City. People are welcome to come. They go to the course.
Yeah.
And, are welcome to follow up later on. They could do it immediately after the course, or they could. Most people will go out and do some things, and then they'll call me up 6 months later and say, you know what, if you don't mind, can I come and hang out for a little bit?
Yeah.
And the other thing too is I've got an online introductory course. It doesn't go into Prolozone yet. That's coming up. But this is an online course for people such as yourself that live so far away. Yeah. It's just difficult, especially these days. It's difficult to, get to the US for the trainings. And so they can do the online course. It's not quite as great as the actual hands-on type course we do, but it'll normally get them started pretty well.
So if I've got a nurse who wants just training, or make sure that she's got some type of certification, she could do that.
Absolutely. The other thing is, by the way, is I'm kind of moving into this zone where I want to get preceptors such as yourself that are good, and what you're doing, you've got the expertise and so forth and so on, all around the world, so that if they take the online course and they say, I really would like some hands-on stuff, I have a list of preceptors that they can go to and get some hands-on personal education. Okay.
And where's the online course found?
So that you would go to, I believe if you go to ShallenbergerOzoneCourse.com, you can access it that way. Just look for online course. Also, if you go to the American Academy website, which is AAOT.us, I believe you can access it through there. You just got to go around and find where courses are, and then it'll tell you about how you access the online course.
Brilliant. Thank you so much.
Well, it's a pleasure to be able to help you. God bless you, Stephen. You keep it up, baby.